welcome to Card Fitness News with your host today, Daniel Barrett.
Good afternoon and welcome to the 6 PM Bulletin. Top stories today. Stephen Ross has been reported missing after a heavy rehabilitation session at the college gym. The 46-year-old lecturer has been reported missing by staff and is also posing a threat to the rest of the world. More information to follow on that story. News. Tokyo Zoo. Breaking news just in. Ginger Scarbarian athlete Thomas Micklethwaite has been ruled out of the Whitby Olympic Games with what can be described as lower back pain. His coach Daniel Wiltshire is now going to us live.
Cheers, Dan. Before we get started, I'd just like to talk about the main areas in which lower back pain, or how we deal with lower back pain in our establishment. There is generally around 3 or 4 problem areas. This is tightness in the psoas major, the piriformis, the glutes, and the quadratus lumborum, with the main pain the athlete or whoever feels lower back pain, the main pain is in the quadratus lumborum. In fact, the tightness in these muscles can cause anterior pelvic tilt, puts the spine out of alignment, which then causes the lower back pain. There is many things we can do, or what we do with our sports therapists here in Scarborough, is we deal with such things as trigger points, PNF stretching, soft tissue release and massage. All these, as a combined treatment with exercise plans, can cure lower back pain. What we do is we first try and release the tension in the areas, whether it be the piriformis, the psoas major, the quadratus lumborum, or even the glutes. Soft tissue release, trigger points are the main thing we start on, kind of release the tension in the muscles. PNF stretching also is a good way to kind of relieve tension in the muscles. And then again, the massage, which a lot of people will be common with. It's becoming a very, very common part of daily treatment with sports and athletes.
Sounds great, that, Dan. So what work that you do with your athletes, will we be able to see a glimpse of that session? I think, yeah, we can see that now.
Thanks for your assistance. So, all I want you to do is just work how you would generally run off corrections going on. Okay, right. So, try not to do something really important when you're back. Keep your legs to the middle. Just keep back nice and straight. In there, a bit further. Okay, so, make grab the legs, squeeze around. So, it's nice and slow. Then you look at the legs. So, your posture's been corrected there, so you always keep your back nice and flat. Okay. Keep your shoulders back a little bit, not so you keep your chest out. Okay, how's that feeling? Okay, good. Right, we'll just do 2 minutes and then we're going to show some mobilisation speed on the spine. Okay? Okay. Are you feeling fine, right? Yeah. How did you yesterday? Still no back pain? No back pain. Okay. All we're trying to do now is correct that technique just like before. We're leaning back. We're back to a lot of pressure on the lumbar part of the spine. 2 minutes. We're just going to go off 1 minute. Yeah. It's nice easy safe way to get it on. So from there, all we're going to do, we're going to do what we call cat and dog. So I'm going to just basically move this back downwards and then back up again. So nice and stretched, so you can back up like that. So all the way down, all the way up. Yeah, excellent. So you're mobilising that by the spine there. Okay? Just run through 15 to 20 again for me. Try not to press your shoulder blades out. Just keep your shoulders square. So just movement comes from your back. Good. Okay, a little bit higher on the upwards. Good, that's it. Excellent. How's that feeling?
Alright, yeah.
Good. How many you got left? 5 left, excellent. Okay. So you can see 5th one, just get a nice neutral spine position there. Excellent. Just widen your knees out a little bit for me on each side. So all we're going to do now is you're looking to maintain this flat back position. So no movement from there. Stick this arm forwards. A little bit higher if you can. How's that feel? You alright?
Yeah, fine.
So just come back in. Again, always maintaining this neutral part of your spine. Left shoulder upwards. Excellent. Yeah. How's that feeling?
Yeah, fine.
Not bad at all. Okay, just do 1 more each side and then we're going to advance this exercise. square. So extend your left leg out, please. Good, yeah, that's good. Try not to extend the spine. Okay. Come back in. Do the opposite side for me. Good. A little bit of tilt there, not too bad. A couple more each side for me. So good. Let's try and keep these hips square as well. Hold at the end if you can. From there. Okay, good. Right, one more each. Are you comfortable with that? You feeling quite confident to move on to something a little bit more challenging? Yeah. Okay, good. Right, from there, all you just do, opposite, so you're going to go right leg, left arm, like Superman does. Okay? Really try and maintain this flat back, square position. Yeah, at the same time. Good. Go back in again. Try and hold it for a couple of seconds again. Okay. Watch your hips go through. Okay, hold it. Right, hold it next one then.
Hold it at the top.
Okay, good, come back in. Right, now do the opposite side. So exactly the same thing, just do the opposite side. Just try and be cautious of this. Yeah, that's it. Good, a little bit straighter in your knees. Make it go. Excellent. Is that quite tight for you there? Yeah. Right, okay. So that's something this to do, so we'll address the hamstring tightness. Okay. Okay, good. Just do 3 more then, on that side. Yeah. And then we're going to move on to something else. Quite good at this one. So this is stabilising form. So looking for here, just bring your feet up to down, that's it, both sides. You're looking to maintain a nice flat back position there, so just push your spine down into the ground. That's good. Okay, from there, all I want you to do is just bring your hips up into a straight line. So you look into a straight line with your knees all the way down to your shoulders. Excellent. A little bit higher if you can. Good, that's good. How's that feeling? Yeah, okay, and just come back down. Okay, we'll look at more, 5 more for me. Okay. So these working glute muscles, again, realigning this kinetic chain, getting all the nerves firing in the correct order again. A lot of back pain is contributed by instability of muscles, especially in glutes and forms around there. Okay, so just do 2 more for me. Good. And 1 more. Okay, from there, just come back down. Tiny little bit of rest, and then we're going to do advance this exercise. So we're going to come up to the bridge, and I want to extend one leg up, so basically bring your knees straight again. So whenever you're ready. Good. Okay, right, try and pick yourself up a little bit, that's it. Excellent, how's that feel? Okay, good. So go again, just do 5 on each leg for me. Again, try to always maintain this high hip position. Excellent. So now we're working core muscles as well. Okay, so we've got 4 left. Higher up with the bridge, that's it. So you can see the instability and weakness in the core there. As you lift your leg up, it's causing you to look down. Okay, so 2 left. Excellent, not too fast, so nice and slow. Enjoy the exercise. Okay, last one outside for me. Excellent, back down. So now we're going to do exactly the same thing on the other side, 5 reps. Good, okay, try and bring your bridge first, then extend your knee. Okay, so come to the bridge. Extend. Good, yeah, pick yourself up, that's it. Excellent. 3 more. 2 more, please. 1 more. Okay, now probably right, a little bit of rest. Okay, now what we're going to do, same thing, so you come into the bridge, I want you to extend your knee, and then bring your leg out to one side. Okay, so you're going to abduction. Then try and keep that position, don't let yourself sink down. Okay. Sweat and glute medius. So just let me know when you feel that way. Okay? Yeah. Okay, you just gently push down on me and hold it for 10 seconds. And relax. Now I'm just going to increase this range a little bit more, so we're going to lengthen the muscle. And you push down again. And relax. Okay, last one. And you push down again. Relax. Yeah. Strengthen as we come back up, so shortening on that. There's a progression for this exercise I want you to do next. Okay. So just move yourself back to the wall. So your feet come onto the ball, bring the ball nice and close to yourself. Okay, so it's exactly the same as what we did before. All you can do now is extend with your knees, so push forwards, and then come up off the ball. So come nice and forwards. Good, then hyper extend up. So try and come back in, try and get it as a fluid motion. So come back into the wall.
Right.
Extend with your knees, and then hyperextend, okay? But again, nice and fluid. So come back.
So when I extend, I'm hyperextending as well.
Yeah, so rather than it being two separate exercises, that's it, much better. So what you're doing now, you realign all the muscles, kinetic chain, educating the nerve pathways to work as well. A lot of people backache tend to have glute fire issues, so glutes work fire, and the other muscles have to take over from there. How's that feel? Is that alright?
Yes, right, yeah.
Yeah, good. Just do 5 more for me now. Try and come a bit closer to your walls to get a bit Good. Okay. A couple more of them there. So what we're doing next, we'll move on to deadlift exercise. It's a very basic exercise. You need to picking up everyday objects. Okay, so what we're going to do now, we're going to coach Tom through a deadlift exercise. Like I said before, deadlift's a basic exercise, picking anything up off the floor. The majority of people, when they pick things up off the floor, they'll just bend down like that. You can see from my position there, that's not a good position to be in. Prone to cause himself back. So, Tom, feel free to move more around as you wish. I'm just going to do a couple of sound demonstrations for this. So, you want your feet out, hip width apart. Okay, from there, bend your hips, so you can keep the back nice and straight. Both hand grip on the bar. From there, head forward, lift your legs, and push through your hips to there. Okay, step towards the back. Feet hip distance apart. Head up, shoulders back. Okay, squat down to the bar. Good. How's that feeling there?
Yes, fine.
Should feel quite a bit tight in the hamstrings and head over the back there. Okay? So just gently take the weight off the bar. Stand on it, push your hips through. Good. Okay, let's run through a few more. So remember to breathe as well. So out on it first. Then on the down.
Sorry.
Okay? Good. So muscles working, glute muscles, hamstrings, and muscles on there as well. To some extent, lats and stabilisers, traps. Okay, so just do 3 more reps on there for me. It's good for strengthening the lower posterior kinetic chain and his core muscles and his back muscles as well. Technique is everything with the squats on, so what I'm going to do first, I'm just going to run you through a couple of squats. Just feel free to walk around, have a look what I'm doing. Okay? Anything you need to know or ask, just give us a shout. So as you approach the bar, grip with the thumbs on the nail in there, step under the bar, looking for it just to be on top of your shoulders, not on top of your neck. Sort of C3, C4. Hip width apart, chest out, and just squat down gently. Just come to parallel if you're comfortable there, and then just back up again. Okay? So most people when they squat, they'll do that. So you can see the difference in the technique. Back upright, squat down, stand up. Okay? And then just re-rack the bar. Okay? Okay, yeah, good. So just step backwards. Feet about hip width apart. Head up, chest out.
Oh.
Okay? Okay, remember to breathe as well. So, in on downwards, out on the upwards. Very good. So, is that about all range you've got in there?
Yeah.
Yeah, okay, so your range is pretty far.
It's very far.
It is, so if you just re-rack the back for me. Okay. What we're going to do is put these in your heels. So when you're opening tight hamstrings and calves, more ankle flexibly, which is going to get you to stand with your heels on the edge of there. Okay? So if you grab the bar, step back, so you just feel the weight on your heels. Okay, from there, just gently squat down again, chest up. Good. Feel a bit more secure and steady for you? Yeah. Okay, so run through a couple more. Good. Back position that time. Okay, excellent. Shoot 2 more for me. Is that feeling alright?
Yeah, fine.
Okay.
Oh!
And last one. Okay, then re-rack the bar for us. Very good. Good. So to finish this session up, we do some nice stretching at the top. So this will strengthen his muscles. We need to lengthen them again to stretch them out. A lot of back pain again is contributing to tight muscles that are being used correctly. Okay, so remember I will show you to go onto the floor. So take a knee, down onto all fours, then roll over onto your back. Okay, so all we do from here, we're going to stretch muscle in the Under the glutes called piriformis. It is one of the biggest contributors to back pain. It also contributes to a bit of sciatic pain as well. Some people have the nerve running through, some people don't. Okay, so bring your left knee up towards your bum. That knee, ankle needs to go over that side. Hands through the legs on that side. Keep around the thigh.
Around here?
Yeah. Shoulders on the ground. Then just bring yourself into a nice stretch. So you should feel that just in that bum there. Yeah, try and keep your shoulders back and relax. I know it's a weird thing. Okay, so hold that for 12 seconds. You can count. Remember to breathe as well, or you increase your blood pressure.
Do you need any equipment you need on it?
Okay, again, try and relax your shoulders down. So 12 seconds on this one. And we would repeat this 3 times each side, but we're going to move on to a different one. Okay, pop yourself back down. Okay, so all you need to do, legs out straight. This one, I'm doing assisted stretching, so I'm going to stretch the quadratus lumborum muscle. Okay. It's a deep muscle, attaches from the lumbar spine onto the pelvis. Okay, it does contribute to a hell of a lot of back pain. It's basically responsible for left and right tilt. So if you're carrying a suitcase, the quadratus lumborum is the one that's controlling you from going on the side. So, just nice and relax. Just from there. Again, it can be a bit of a weird stretch. How's that feel? So yeah, you are quite tight in there. Okay, so just hold it for 12 seconds as normal. And we'll swap sides. Most people generally have one side that's tight and the other side. Okay. So same position again. Just remember to breathe through this. So this side's not as bad as the other side. Okay. Yep, that's it. So all you need to do is just sit up for me. Okay, from there we're going to stretch the glute muscles. Foot over that side, so just bend your knee. That's it. Hands on that side, and then twist to face me. So the shoulders and everything over this side, you're applying pressure on there. So you should feel that down that side. Okay, exactly the same drills, so 12 seconds, then swap sides for me. Again, remember to breathe. Okay, swap sides. Yeah, again, we do 3 times each side on there, but for the demonstration, we'll just do once. Okay?
Right, this is how we do a soft tissue release of the piriformis muscle. If you like to come in, we can see. If you locate the great trochanter, alright, you make a V there, and piriformis is roughly in between that V and there, so around in there. Alright, what I'm going to do is going to get Tommy just to lay onto his side. I'm going to bring his right leg over, side I'm working on, keep it on straight, just relax, Tom. Good. Locate the great trochanter again, make my V, roughly about there, alright. As it's quite a big area, as the glute can get straight in there. Alright, found the piriformis there. Alright, just keep breathing, Tom. A little bit painful?
Yeah, a little bit.
Good. And I'll just hold that for around 30 seconds. Good. What I could do, I could get him to bring his right knee up to his chest. Good. Nice and slow, good. And I'm keeping that pressure in there. Good. How's that feel, Tom?
Perfect.
Perfect, good. Alright, good stuff. Good man. I'm relaxed. So, just going to flip onto your front, Tom.
Yep.
Front.
Front.
Like it. Alright, go into the glute now. So same again, what I'll do is I'll bring his leg up into here. Alright, same again, I'll apply my block, I'll do it with my left, so I can control his leg with my right hand. Find a tender spot in there, and all I'm going to do, if you want to come around, Danny, you can get this side. I'm just going to externally and internally rotate, like that. Alright, painful, Tom?
A little bit, yeah.
A little bit? Good man.
I feel it.
Good, and again I do that for around 30 seconds so it eases. Good. Alright, now I'm going to go into some soft tissue release of the psoas. Okay, to locate this muscle, find Tom's belly button, not there. Alright, come about an inch down, okay, and you can see it, you can feel it through his abdominal wall there. Alright, so as Tom breathes out, I can sink lower down into that muscle there. Alright, feel that, Tom? Yeah. Alright, and all I'm going to get him to do on this left side is to replicate him riding a bike. Good, and I can feel that muscle lengthening and shortening underneath my fingers. Good, and again I'll hold that for around 30 seconds and wait till the pain goes down. Alright, good, Tom? Good. That's soft tissue release of the cells.